Well, I'm O P Yadava. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Certainly, bypass can be done with along with carotid artery intervention. That's what we call simultaneous procedures, and different models can be used. Either a carotid artery can be done first, and we leave the carotid incision open, then do the bypass surgery, and then go back and close the carotid incision. And why we do that is because if we close the carotid incision first, and because we use anticoagulation, there will be hematoma formation in the carotid site. Or we can do the coronary surgery first, and then the vascular surgeon can take over and do the carotid intervention or carotid endarterectomy. But each has its plus points and minus points. With carotid first, we run the risk of a myocardial infarction, and with the coronary first, we can run the risk of a stroke. Therefore, a simultaneous procedure in which we do the carotid endarterectomy, leave the wound open, do the coronary, and then go ahead and close the carotid wound is probably the best method. But one has to select the patients very carefully, that a patient has to be symptomatic and the carotid stenosis should be significant, and we should not be doing simultaneous revascularization in either asymptomatic patients or in chronic total occlusions, and therefore selection of patients is of prime importance.